I'm Dr. Joon Lee. I'm an interventional cardiologist at University of Pittsburgh Medical Center. As a cardiologist, I deal mostly with patients with heart disease with a special emphasis in procedures that we do through thin plastic tubing called catheters. And unfortunately, despite a lot of advances, heart disease remains by far the #1 killer in the United States. And most of the heart disease that we deal with is what's so-called coronary artery disease or myocardial ischemia. Heart is the main pump that pumps blood to the rest of our body, but unfortunately it is a muscle like any other muscle and requires its own blood supply. And when narrowings or blockages develop in these blood vessels, which are called the coronary arteries, then we have a problem, and that the muscle is not getting adequate blood flow, and this can sometimes result in heart attacks or can result in the limitations for patients. That is, patients can get pain or otherwise are not able to do their regular activity because their heart is getting inadequate blood flow. This is the condition that we've been focusing on. Heart attacks are by far the #1 killer in the United States, killing over 800,000 people every year. And coronary artery disease affects, it's estimated, more than 13 million people in our country. So in order to treat this disease, we have many different tools currently, mainly focused on medications and specialized procedures and surgery, such as bypass surgery, or much of what I do, which are called coronary artery stents. But despite these very advanced therapy, we unfortunately have many patients who are still very much limited by our heart disease. And this is where the field such as regenerative medicine comes in. In contrast to the traditional thinking that the heart was incapable of regenerating itself, what we now understand is that even in adult human beings, there is a low level of regeneration. Bone marrow cells are circulating in the blood vessels, and a small number of these cells will reach the heart and regenerate itself, even on a normal basis. So this brings us a lot of hope in terms of what we can do to damage heart muscle or damage heart blood vessels. And this is where regenerative medicine and treatment of cardiovascular disease really intersect. So what we're trying to do is to really accelerate this process, which we know occurs all too slowly for those people who have heart disease. If you look specifically at some of the protocols that we're testing, what we do is to treat patients who have inadequate blood flow to the heart muscles. For example, when a patient has inadequate blood flow because they have blockages in the blood vessels that supply the heart, what we would like to do is to supercharge the normal process that occurs. The normal process we know is that there's a small number